Dr. Brad Condor here with Focus Physical Therapy, and today I wanted to talk about 4 ways you can beat low back pain. Low back pain is one of the highest healthcare costs we have in the nation. It's very difficult. It's something that I see a lot of. I actually like helping people with low back pain because I feel like I've seen so much of it that I can help them, and I've had it myself, and I know how bad it can be and how debilitating it can be in your life. So I want to give you some advice today as far as 4 ways to beat low back pain. The first thing to consider is what really increases your low back pain. So a lot of times people come in and I ask them, okay, what caused your pain? And they might say, I don't know. I don't know what makes my pain worse. And it's one of those things you really start to have to be mindful of it. Does it hurt more when I sit? Does it hurt more when I stand? Does it hurt more when I move? Those things actually help you a lot to kind of figure out what you need to do to kind of help your low back pain heal. So for example, if you're sitting all day and your back pain is getting worse and worse and worse, but you go to stand and walk and it feels much better, you need to do that more often. I know it sounds simple, but a lot of times we get stuck in habits where we don't give ourselves enough time to kind of move. And that's kind of a good example of this, learning what actually causes your back pain so you can try to make changes in your life to really kind of counteract those things that are directly leading to your low back pain. And as I kind of alluded to, the second thing you can do to kind of help with low back pain, especially if it's chronic, is start to learn more about how your body acts and start to get moving. There's a lot of research showing that low back pain, say like a bed rest, does much worse. We actually do better when we have movement. Now, there's some cases where some movements aren't going to feel good, rolling around in bed, running, doing high level exercise. That's okay, that's something that we gotta work toward, but not letting it not giving into it and sitting around. So you wanna do a little bit of walking. A lot of back pain people will do a small walking program and get a lot of benefit out of that. Not all conditions do that, but a lot can. And then also start to learn what makes it feel best. Does walking feel good? Does it not feel good? And do more of those things. So if walking feels good, do a little bit more. Don't do a lot more, do a little bit more. And sometimes you can find stretches that also feel good, that kind of you want to do more often. I find a lot of people, when they're learning about how their back moves, they find 1 or 2 things that help and they just don't do it as much as they should. They kind of only do it when they need it, but you want to do it consistently on a daily basis. Next thing is, you really have to start changing your mindset as far as how to deal with this. I've always told my patients, dealing with low back pain is kind of like a diet. You can't expect to start a diet and lose 20 pounds overnight. And you can't have low back pain, even if it's acute low back pain or if it's chronic low back pain, you've had it for a long time. Start 1 or 2 things and get 100% better overnight. So you have to kind of dedicate yourself that this is going to be a process. Something in your life has led to this, and you can actually, no matter how bad the issue is, you've got bulging discs, you've got arthritis, you've got all these other things you've seen on MRIs. You can actually you can't fix it, but you can actually manage all those problems and get as pain-free as you want to be, but you have to have the mindset that you can do it. You can start an exercise program. You can go to someone like myself to kind of actually take a look at this, get it feeling better quickly, and get it to where you can take care of it on your own. So you've got to really kind of change your mindset. You can get better, you will get better, and I'm going to take action to do so. So that's a very important part about low back pain. If you really, really want to get better, you have to make sure to dedicate yourself to it. Lastly, physical therapy. You know, I know it sounds kind of like self-serving a little bit with this, but you know, physical therapy is shown to be one of the most effective ways to treat back pain. And you may have even experienced some therapies in the past, or maybe chiropractors, you're like, well, it didn't really work for me. What I have to say about that is just the best research shows the best outcome for low back pain is a good mixture of good evaluation from a therapist that sees this a lot, good manual therapy that someone puts your hands on you and actually makes your back feel better and movement right away, and exercise. The exercise component done right by a good therapist that takes the time to do so can be a big deal as far as making your back pain move forward. Research shows that a good combination of those 3 get back pain where you want it to be. If you just do one of those things, you may not have the outcomes you're looking for. And so the way we do physical therapy at Focus Physical Therapy does give us the time to actually do that type of treatment for you to where we're always listen to your problems, listen to your goals, do a good job of evaluating you as far as what your actual deficits and why this happened. And we always do our manual therapy and then also the good exercise prescription to allow you to kind of take care of this on your own and stay better. So I hope this helped you out. If you have any more questions, please reach out to us. You can reach me at 502-509-3136. You can call or text or email me at drconder@physicaltherapylouisville.com. Please look at our other free resources to help you hopefully make a good decision, get your back pain where you want it to be. Just remember, you can be good. You just got to take the first step to kind of find somebody that can help you get to where you want to be as far as pain-free life and get back into everything you want to do. Good luck. Maybe we'll see you soon.